Ted, you are a hard act to follow. My father was born in New Philadelphia, Ohio, Tuscarawas County. And he played for an undefeated state championship football team. And his coach, his first 2 years of high school, was a man by the name of Woody Hayes. It was before Woody ever went to Ohio State. And my father always used to say what Woody would say. He'd say, "You're going to fall down a lot. You are going to get tackled a lot. You will be on the ground a lot. And what will distinguish you from all the other teams is that you will get back up every single time and never, 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 never give up." That's what you're here today for. That's why you're here. You're not here to give up. I want to thank Becky and Brian and Tim and all of you for being here today, as well as all the elected officials who are here today. But I think it's fair to say that the way Barack Obama got elected was from the ground up, not from the top down. And this is the ground up right here. I do believe that if we remind the men and women in Washington, D.C. today who we elected, not only that we will not give up, but that we actually do believe that health care is not, as Becky said, a Democratic or Republican issue. It is an American issue. There are 1,800 people today who will go bankrupt because of their medical bills. And there are 6,000 people today, before we go to bed, who will lose their health care insurance. Years ago, I met a woman by the name of Linda Kern. She lived right here in Columbus. Linda had cancer. And I got to know Linda. She became a very close friend. And her health insurance company first denied her coverage because of a pre-existing condition. And I saw some of the signs here today. Caution, pre-existing condition. Right now, the pre-existing condition in Washington, D.C. is that we are broken and frozen. That's the pre-existing condition. But Linda was like Woody Hayes. She fought back. She fought back at the insurance company, who also would not cover the experimental drugs that could potentially save her life. A number of us worked with Linda, but it was Linda really who was the hero. She beat the insurance company. They finally gave in, and it extended her life by 2 or 3 years. But Linda's no longer here. And I think about Linda all the time because I actually believe that we're here today not just for ourselves. We're not even here today for our children and our grandchildren. We're also here for the people who I think didn't get that opportunity. And in their memory, we need to do this as well. In the memory of people like Linda Kearns. This bill must, more than anything, have two things: a public option in and a tax on middle-class health benefits out.
Yes.
I agree with Becky. The perfect is the enemy of the good. I do believe that if legislation passes and it does not have what we want, then we go back to Woody Hayes. We never, never, never give up. But right now, the world is watching. Is this real change? Or do we just sort of put our heads down and say, gee, we didn't get it this time, maybe next time? Well, all you have to look to what's happened over the last 20 years and know there may be no next time. Do it now, do it right. Thanks.